So beneath all the political stories and stories coming in from Operation Sindoor, one thing you might have read in your morning newspapers which could be giving you concern, that is COVID-19 back in India? Now, recent reports say of a surge across Southeast Asia have raised this very pressing question. In Hong Kong, the health center says virus activity is quite high and the testing has also reached its highest in a year. By the first 3 days of May this year, Hong Kong has reported 31 severe cases. In China, which is where it all started, COVID-19 positivity rate has increased from 7.5% to 16.2% in the month of April. In Singapore, hospitalization has increased with a surge in COVID-19 cases. According to reports, the cases have jumped 28% to 14,200. It was about 11,000 the previous week. But then let's talk about the situation in India. Now, official government statistics say that there are 257 active cases as we speak. The government, however, maintains all is well while assuring that these cases are only mild. Experts have broken down the new threat, reassuring the public that there is no need to mask up yet, but vigilance remains key. We're going to be discussing that with my colleague joining us from Mumbai as well as a guest as well. Dr. Sanjeev Bagai is someone who is probably best placed to tell us about how to be aware of COVID-19 and keep ourselves mentally as well as physically fit. Dr. Bagai, with your permission, I'll just go across to my colleague to get a quick status update from Mumbai. Rucha, the reason I'm coming to you is because there have been confirmations coming in of 2 deaths that have happened due to COVID-19 in Mumbai. Could you confirm this and give us details as to what led to them?
Well, on Sunday, these 2 deaths were reported from KEM, King Edward Hospital in Mumbai, and both the patients died due to comorbidities. Now, BMC and the doctors have confirmed that the deaths are not directly due to COVID, but there were other reasons, other diseases that the patients were suffering from. One was a minor case, a 14-year-old girl who was already suffering from nephrotic syndrome, which was also diagnosed with COVID, and also a 54-year-old woman from Sindhudurg. She was suffering through cancer and happened to be a patient of COVID-19. Now, in past few months, we have seen that there have been reported, the cases were reported from Mumbai's hospitals, but they were mild cases, and in these 2 cases, it was found that both the patients had COVID-19, but the BMC and the doctors have confirmed that these are not direct COVID deaths, but the BMC has also issued alert that the people of Mumbai should remain alert, remain aware, and continue to follow the measures that we were following during COVID pandemic and during lockdown days. Now, it is not a situation of panic. The government has also appealed to the people of Maharashtra and Mumbai.
It is not a situation of panic, which is why I think, Rucha, as responsible broadcasters, it is our job to tell our viewers what is the exact picture and what they need to do. Rucha, thanks a lot for getting us that update. It was very important to understand why those 2 deaths have happened in Mumbai. Dr. Bagai, thanks for being with us. Always good to speak to you, especially on an issue like this. First and foremost, explain to us what's really happening in Southeast Asia, in countries like Hong Kong, in Singapore, in Thailand, etc.
Good morning to everyone. So the COVID has never gone away. It's perhaps one amongst the largest and the longest lasting pandemics per se globally. What we are seeing at the present moment in various parts at various intensities, various parts of the world, is the Omicron sublineages or the subvariants, and there are more than approximately 1,700 sublineages. The one which we are seeing now in Southeast Asia, especially towards Hong Kong and Singapore and bits and parts of India, is a variant of BA 2.86. That was the initial parent subvariant, and now it has diversified into what we call as a flip mutation, in which we are now seeing in India what we call as JN.1, but in Southeast Asia and other places in Hong Kong, we are seeing other kinds of sublineages of JN.1 and XDV. What this basically means is there is a single mutation which has taken place in the amino acid chain, which has caused this particular JN.1, which is being seen in India, in Bombay and in southern India, especially to be more transmissible, but not more infective. So that means it's not more deadly. It is still mild. It causes just upper respiratory symptoms like cold, cough, sore throats, fever, runny eyes, weakness, muscle pain, headache, but only in the specifically vulnerable with comorbidities like the two cases mentioned in Bombay. Both were immunocompromised. This can take a more serious turn. The bottom line is that COVID hasn't gone, Omicron has not gone. It will stay for a while more, but we just need to keep simple precautions, what we
Dr.
have
Bagai, I'll
always
come to
learned.
those precautions later. I just want to put it in perspective what you've just said, that COVID hasn't really gone, and which is why that does not mean there is any reason to panic, which is why let me just spell out 5 reasons why we feel that there is no need to panic. Now, number one, all the cases that you are seeing so far in Southeast Asia, especially in Singapore, in Thailand, in Hong Kong, in South Korea, are mostly still mild. Yes, hospitalizations are high, but people are not dying in the droves like we've seen during the first and second waves of the pandemic. Next up, the second reason why we don't need to panic is that out of the 257 active cases in India, most of them, there's not been any major spike in cases in India so far. There are only 257 active cases. Now, as Dr. Bagai was saying, at the end of the day, COVID-19 is a flu. And flu has seasonal variations, which is why we all remember falling ill periodically on seasons. This is what is happening. Understand that the COVID-19 virus in its various forms has been there for the past 5 years now. So by now, herd immunity is quite strong, and there's still some amount of protection from the vaccine doses which we have all taken. And finally, perhaps most importantly, these are cyclical variations of COVID that will continue, as Dr. Bagai has been saying. There's no need to panic. Dr. Bagai, coming back to you now. And take us through the need of precautions or the stage of precaution that we need to take. Because I don't think there has been an advisory to mask or social distancing which is coming yet. But there is still some basic precautions which we can always take, which one should be taking in any case to avoid any infections. What are these for the benefit of our viewers?
It's a very important question. So just to take off from what you have just explained, this particular strain of GN.1 is not more lethal than any other strain of COVID. It is still mild. Therefore, the symptoms are mild. We need to keep self-precautions. So hand hygiene is important. Avoid very, very crowded places, poorly ventilated places, or avoid contact with people who have an upper respiratory syndrome, or indeed what we call as a URI or a runny nose or a cough or a fever. Self-precaution is important. If indeed you are feeling any viral symptoms, stay at home for a couple of days and don't self-medicate. The simplest thing to take is just simple paracetamol. India is well placed because our vaccine doses have crossed 220 crores and there is a level of natural immunity which has built. Reinfections of mild type have happened pan-India, and a lot of people would have had asymptomatic COVID during the early phases. The vaccines have held India in phenomenal state at the present moment. More than 90% of the eligible population have received double doses with a booster. So India is well placed. We are well geared. The medical systems and protocols are well in place. But the bottom line is there is no panic. There is no anxiety. Take self-precautions and make sure that in case you are unwell, consult your doctor. Don't expose yourself
Dr.
to
Bagai,
others.
specifically on that point, because as you mentioned, there's no need to panic, and I believe that the fight against COVID-19 is as much a mental and psychological fight as it is physiological. The main concern which a lot of our viewers is that every time they see a spike in COVID cases anywhere in the world, the next time they feel symptoms of fever or cough and cold, they automatically think, oh my God, COVID nahi ho gaya hai. At what point do we take a decision that, okay, do I need to get tested for COVID, or is this a regular flu which I can just take basic paracetamol and basic rest and take care?
So the initial first 2 or 3 days of Omicron, which is GN.1, which is a sublineage of BA.2.86, is exactly the same as any other viral illness, indeed including a flu. Although Omicron is not a flu, it's a separate entity, but the symptoms are exactly the same. So the warning sign is any high-grade fever lasting for more than 24 to 48 hours, severe headache, any rash, nausea, vomiting, especially if you have comorbidities, consult your doctor. Getting a repeated test for SARS-CoV-2, as what we used to call as RT-PCR, is not recommended at the present moment. Mask will save you not only from SARS-CoV-2, which is Omicron, but from host of other viral respiratory infections. So mask is something which is always a good idea in a community living, but avoid close crowded places and poorly ventilated places.
Okay.
There is still no issue of having any anxiety or worry in the mind. Please do not self-medicate and do not take unnecessary antibiotics on your own at home.
All right, Dr. Bagai, I hope our viewers have been listening. I'm sure they have been, all their concerns have been put to rest as well. Thank you so much for joining us. It's time for a short commercial, but the morning news hour continues with me. Stay tuned.